Assalamu alaikum and good day. We will continue with topic number 4 today for Unit 5. Topic number 4 concerns about the after treatment protocol. So this is the last bit of the uh, treatment protocol for your patient. Learning outcomes. Number one, again, to identify the risk after completing the treatment, and then to demonstrate an appropriate protocol after completing patient treatment in a dental clinic or operating room. Right, so let's look at the risk. Okay, just imagine after you finish the dental treatment for your patient, you will end up with a lot of instruments, dirty instruments that you have been used. There are a lot of disposable items, especially gauze, needles, and others. Okay, so you need to identify the sharp items. You need to know also contaminated items surrounding you, and also the body fluids that might have spilled during the dental treatment. So as for sharp items, you need to identify all sharp items, either disposable or instrument itself. Be careful when you managing those items, not to prick yourself with these sharp instruments. And those disposables one, you need to dispose the sharps into the sharp bin available in your clinic. For the contaminated items, for example, the instrument surfaces or surrounding equipment, you need to thoroughly disinfect these surfaces after the patient left your clinic or operatory room. For body fluids, you need to identify any areas that you may contaminate with body fluids during the treatment. So, for example, if you detect any blood spill, just treat the spill according to the guidelines, and it does require immediate management or immediate attention from you and your team in the dental clinic. Okay, once the treatment has completed or ceased, remove the bib or any protective attire on your patients and throw immediately into the clinical waste bin or disinfect for those who are not which are not disposable. For example, the goggles or protective eyewear and bib clip. Okay, once you discharge the patient actually can be encouraged to wash their hands before leaving the operatory because they might touch several surfaces upon entering the dental clinic and during the dental clinic. So just get them to wash their hands before leaving the dental operatory room. Change your gloves. So you have to throw the gloves that you used for the dental treatment and put on a new glove for the disinfection process of your operatory room. Um, and then you need to segregate the items, the instrument for disinfection prior leaving to the sterilization room or the CSSD if you're in the hospital. Dispose all the disposable into the appropriate bins. And then if you have any items to be sent to the lab, for example, impression or prostheses, you need to do a proper disinfection prior to transfer to the lab. Okay. Number five, you need to disinfect your instrument prior to reprocessing in the sterilization room or CSSD. There are a few methods available or based on the manufacturer's recommendation. So most of the method used is to spray after you wash. You need to wash your instrument first with the water, running water, and then you can use the disinfectant, appropriate disinfectant, to spray the instruments. So this is just to prevent drying of soils on the dirty instruments. So the in the sterilization room, they wouldn't have any difficulty of removing the debris. Okay. Number six, you may need to disinfect the items to be transported to the lab. You need to follow the guideline presented in the Unit 5, topic number 8. Disinfect the surfaces, definitely. Cabinetry, dull chair, equipment, desktop, and definitely stools as well. Make sure that once you remove the film barrier, you do still need to disinfect them with disinfectant available. Commonly used is actually the alcohol wipe. Just make sure that all surfaces are disinfected first prior to calling your next patient. Okay. Lastly, doffing your PPE. So after you finish the disinfection process, you may now remove your PPE according to the doffing sequence. Okay, so hopefully you still remember your doffing sequence from our previous units. Okay, so please do that. And lastly, definitely you have to wash your hands. Okay, that's it for the post-treatment protocol. Hopefully you understand from the pre, during, and after the treatment protocols. Thank you.